West Africa's Ebola epidemic is now an international health risk. The declaration was made early on Friday by the World Health Organization. The WHO has also warned that Ebola could spread further.
I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern. The committee's decision was unanimous. Its advice to me acknowledges the serious and unusual nature of the outbreak and the potential for further international spread, but also the need for strong international coordination of the response.
The declaration of an international emergency should raise the level of vigilance for transmission of the virus. But the WHO said a lack of resources in the affected countries remains a major challenge in containing the outbreak.
The declaration of a public health emergency of international concern alerts the world to the need for high vigilance for possible cases of Ebola virus disease, but by no means implies that all countries, or even many countries, will see Ebola cases. Only a small part of the African continent is currently affected. Above all, the committee's conclusions and my decisions are a clear call for international solidarity. Countries affected to date simply do not have the capacity to manage an outbreak of this size and complexity on their own.
States of emergency are already in effect across West Africa, with entire communities placed under quarantine. In Liberia, government troops set up Ebola roadblocks and stopped public access to some of the worst-hit towns. The actions, which could last up to 90 days, are already causing concern among locals.
For now, we can't even cross to go for water in the fence there. Since yesterday evening, some are not even get water to drink, we get water to take back.
Although most cases of Ebola are in the remote area where Guinea borders Sierra Leone and Liberia, alarm over the spread of the disease increased last month when a US citizen died in Nigeria after traveling from Liberia. According to the WHO, Ebola has claimed at least 932 lives. Ebola specialists have urged the UN agency to offer experimental drugs to Africans after being used to treat 2 US charity workers infected in Liberia, an option that's expected to be discussed next week. Clementine Logan, CCTV.